Well, how did I come to think about nursing as caring? You know, I've been a nurse since the 60s and have studied nursing in regular ways, studying it from a systems perspective, teaching it from a systems perspective, just as I was taught. And I think that's very common with faculty, that we teach as we were taught. In all of the different places that I had taught, there was one thing that always bothered me, and that truly was that I didn't think we were really studying the discipline of nursing. And over the course of many years, we developed the study of caring. We did a little bit of caring. We went to the literature and we studied it a little. And we realized that there was really a formal way we could really study caring. And we began then to study Mayeroff, and we began to bring in works that were really substantively grounded in caring. And it was the nursing situation that really filled that void for the study of nursing. The importance of nursing as caring is that it is a perspective that is grounded in the humanness of personhood, that it is grounded in the phenomena of nursing as person. And that is what it is all about. It is coming to know person, to respond to person, to research from that human perspective, and to answer the questions that matter to those being nursed.
In working with faculty, we recognized that there needed to be a shared consensus of an understanding of caring to undergird the curriculum. However, Anne and I wanted to go beyond that curriculum work and actually develop a full-fledged theoretical, systematic expression of nursing as caring. We asked ourselves, in our view, what's the unique focus of nursing? Where does caring fit as a central part of the unique focus of nursing? And what we came up with was the understanding that's stated in our statement of focus. Nursing is nurturing persons living caring and growing in caring.
Nurses are all wrapped up into one thing. They're educators, they're care providers, they're social workers, they're your best friend. It takes a very special person to be a very special nurse.
Yeah, my dad's 80. Born in Sicily and came over on a boat when he was 2. And so he has congestive heart failure. Spent a month in CCU, and that's where we met Scott. And Scott, he's a great nurse. See, I think he was key in my dad's recovery. He had a tube down his throat and he lost the ability to swallow. They told us, get used to it. He's going to have the feeding tube for the rest of his life. It was devastating. Scott's like, he's going to get better. See, that's what helped is Scott never let on. And he would have him practice swallowing before the speech therapist would come. Scott would get him to swallow it, put his finger in his throat, keep getting him to practice. He's like, Jack, you want that ice cream? He'd dangle that carrot. You want that ice cream? You have to swallow. I think that was pivotal because eventually he did pass the test. And the first day that he was able to eat ice cream, Scott brought in a big tub of chocolate ice cream.
Remember, I wanted some chocolate ice cream and he brought it to me.
And my dad's eyes lit up. Me and my brother, my sister in there, we just lost it. It was just one of the greatest moments. I'll never forget that. Now my dad's at home. And, you know, Scott had everything to do with that.
I'm so thankful for Scott. He's dying for chocolate ice cream.
He took a traumatic situation and not only made it manageable, but made it quite pleasant at times. He's a great guy.
hospitals, I've lost track of the number, have used, for example, the Novice to Expert and the Clinical Wisdom and the Expertise in Nursing book to develop clinical promotion programs, and even better, to develop projects of articulating knowledge embedded in their most expert practice or in breakdown situations. They've also used the Novice to Expert as a way to think about orienting new nurses and for mentoring them across the stages of skill acquisition. I suppose it would be appropriate to close by saying that every nurse in practice has an incredible vantage point on the human condition, on the value of connection and care, and is in a great position to articulate what they learn experientially from their practice.
As nurses, we are given expert training. We seek out knowledge. Through the knowledge and the expert training, we now add experience. And with that experience comes the passion and the heart.
Tea time for you now. Oh, tea time. I prepare some tea and biscuit for you. Is it okay?
Okay, thank you.
I joined Raffles Hospital in 2007 after my sponsored course in Accelerated Diploma in Nursing at Nanyang Poly. I'm the nurse clinician of Medical and Surgical Ward. Nursing is a unique career that requires one to wear many hats. One needs to be a competent medical professional and compassionate people helper. A nurse must have a heart to serve and to care. She should be sensitive and a good listener. Most importantly, good nurses are equipped with excellent skills to heal.
Yan Yan is very passionate about her work. There is this zeal in her that drives her to do her best for patients and staff.
As a nurse clinician, I provide leadership in clinical care, management and coordination of all patient-related matters. My key role is to supervise and work closely with the multidisciplinary medical team so that our patients will receive the best care possible. In order to give our best, we must constantly upgrade ourselves by gaining more knowledge and applying them to our clinical practice whenever applicable. Nursing is a calling. You must have this desire to dedicate your life to help others. In our vocation, people entrust their lives to us. When we care for them to the best of our ability, patients can sense our sincerity. Even when times are hard for them, they know we are there for them to help and comfort, and that gives them the strength they need to pull through. I love my job because I'm caring for people and touching lives. I also have the opportunity to nurture the younger generation of nurses and guide them in their work. As such, I'm never bored. When you are a nurse, every day is different, special, and meaningful. You will touch a life, or a life will touch yours.
Research nursing is a unique specialty, unlike any other area in nursing.
Research nursing offers unique challenges for all of us.
Whatever you have done in the past in nursing, whatever experiences you have learned along the way, you will utilize them in this specialty area.
Whether it be working with a population of normal healthy volunteers or patients with advanced disease, we have unique skill sets, and there's a lot of training and development that goes into working with all of our studies.
Our mantra in the Phase 1 Center is hugs and drugs. We like to provide patients not only with the clinical support because of the uncertainty of these drugs, but we also like to provide them with support. And so before any of our patients leave to go home for a day, they get a hug so that they feel more comfortable coming back. And they know that we're all here for them, and if they have any questions or concerns, that they feel very comfortable with us.
I put participants at ease. We're trying to explain to them in common terms what's going to happen to them. Most of the time, after we're done talking to them and go step by step, by the end of it, they're actually pretty content that they enrolled in the study. And hopefully it's going to help the future generations.
When the researchers come to the table with the community, they have to understand their fears and to be able to talk to them and answer their question completely. When you mention the word research, they automatically thinking that they're guinea pigs. As a community-based research and advocate, I want to ease their fear, and at the end, they feel like they contribute now and in the future.
inventor developed a concept from novice to expert. This concept explains that nurses develop skills and understanding of patient care over time, from a combination of a strong educational foundation and from personal experiences. According to Anne Boykin and Savina Schoenhofer, the most basic premise is that all humans are caring persons. That to be human is to be called to live one's innate caring nature. Developing the full potential of expressing caring is an ideal and, for practical purposes, a lifelong process.